We were in Seattle visiting my son and 4 grandkids. And I was there for a week. And the night before I was ready to go home, I just knew something wasn't right. On November 19th, I had to be rushed here to Advent Health Tampa via EMS on oxygen because I could not breathe.
I came to know Mr. Zulli in early December when he was in our COVID ICU, and he was sick with COVID pneumonia and respiratory failure, and he was requiring a lot of oxygen. He was on a BiPAP machine, and when patients are on BiPAP, we're almost really concerned that they may deteriorate and need to be on a ventilator.
On the COVID unit, it's easy to feel alone, and it's really important that we don't feel alone. As you are in this big, loud room in a negative pressure room, you don't get to talk to outsiders very often, and everything is very funneled as far as noise goes. So motivation is key, and we do that by assuring him that we do care for him and we're there for him when he needs us.
He was very critical. He was in a very critical condition. He was requiring a lot of oxygen. He was on the BiPAP machine, and he was one of our sickest patients because those are the moments in time where they can either get worse and required to be on a ventilator, or they can do better and continue to be on the BiPAP and require less and less oxygen, which was the case in Mr. Zulli.
Being a registered nurse, my priority is always safety. And it's not only if the patient's safe, it's also if they feel safe. Most of our conversations that I had with him was surfaced around that. I wanted to make sure that he knew he was safe. So a lot of times I tried to speak about his family, let him know that I was there for him and he wasn't alone going through this.
They were just absolutely the most wonderful people, and nurses and respiratory therapists and doctors I could ever have wanted. They were just so compassionate, so attentive, so on top of every change in my prognosis or in my illness.
Mr. Zulli was a good case of how we did everything we can, and it's a miraculous blessing from God that he pulled through and he made it this far. And it's been difficult for us to sit back and know that we've done everything and see some that pull through and see others that don't.
They were just the most compassionate, wonderful professionals ever.
And I've worked at a lot of other hospitals in the Tampa Bay area, and I chose this place in particular because this is where I would want to be treated if I was sick. This is where I would bring my loved ones. And for that reason, I've been working here all this time.